Welcome everybody, and what I thought I would do is just briefly describe some really interesting lung things, and I'm specifically an occupational respirologist. So I've kind of looked through some of the topical areas. Some of them will go into greater detail in the presentations, but this is just a little bit of flavoring of some things that you've probably never even thought about. Popcorn worker's lung. And this is something which has just been described over the last couple of years. And it was noted in a factory, specifically in the States, that makes the microwave popcorn. And a number of workers were presenting with cough and shortness of breath, so they went in and they did a study to find out exactly what was occurring. And they found out that the artificial butter flavoring, diacetyl, was causing the problem. And a number of people actually had a higher rate of asthma. They actually had changes on the breathing test, and they now know that through animal studies that there is a toxic effect of this in the lungs. So something as simple as making popcorn, which you would kind of think would be a fairly safe occupation, has been associated with occupational lung disease. So the next time that you go to the movie theater, just remember people have developed illnesses making your popcorn. The next one, rather interesting and quite sad, is that of the World Trade Center lung disease, or it's called the World Trade Center cough. And this actually presented several weeks to months after the collapse of the World Trade Center. And firefighters were presenting with cough, and the cough tended to be a dry cough, spasmodic coughing, some associated shortness of breath. And actually they were looking at, they've been following the firefighters all along, and those with a higher exposures have more incidence of this disease. Those with less exposure still have some cough, but not as severe as those who are working right at the site. The cough was persistent. Some of it was related to asthma, and they're actually following some of it along. They feel that most of the cough is related to the cement dust, and cement is very alkaline. The pH is elevated, and it causes direct irritation to the lungs. And as you could see in the picture below, that with the collapse there was this big plume of cement dust, and I think most of us can remember watching the newscasts of the cement dust just rolling down the roads. And so they're being monitored, and the first person has actually died a couple of weeks ago related to the World Trade Center lung disease. Hot tub lung. Those of us, especially in southwestern Ontario, we love our pools, but we also love our hot tubs. And just to let you know that not only is it a wonderful, relaxing place to be, there are skin diseases related to hot tub, but there's also something called hot tub lung, and what it's related to is actually a reaction, sensitivity reaction in the lung to a bacterium. And it's very similar bacterium to that which produces tuberculosis. And it actually causes inflammation in the lung. When you become sensitized to the proteins in this bacteria, very minute amounts can cause problems. So in essence, the only treatment is avoidance of the hot tub. And the other is that you have to really be careful keeping the hot tub clean and keeping the pH, the proper pH, and the amount of chlorine, and that will kill off the bacterium. Air pollution. This is another area that's quite interesting for those of us who live in southwestern Ontario. And looking at long-term effect, there's been a lot of information out in the newspapers lately about air pollution. And one in particular is the association of air pollution with respect to heart and lung deaths And the risk factor is comparable to being moderately overweight. And this one paper actually kind of compares the two. And being moderately overweight does increase your risk from dying from heart disease, as well as high blood pressure, strokes, as well as respiratory problems. So this is kind of interesting because they've actually kind of put a comparison value to it. I wanted to briefly talk about mesothelioma. And just to give you an understanding, mesothelioma is a cancer of the lining of the lung. It is related to asbestos exposure. To give you an idea, over on the other side, do we have a pointer? On the other side is an asbestos fiber. That's what it looks like. They tend to be long, skinny, and thin. And in comparison to a human hair, it is that little dot at the side. So they're very, very small fibers that we breathe in. Because of the nature of the fiber, it migrates out to the periphery of the lung, and that's where it causes the irritation and causes the cancer. Mesothelioma accounts for 10 to 18% deaths among workers exposed to asbestos. The latency period is a long...
The yellow button.
Oh, the yellow button, thank you. The latency period is anywhere from 15 to 40 years after exposure, and that's what makes it very difficult. So when somebody comes to see me in the office as a physician and I ask them what work they do, I may not necessarily get to what the original work was where they were exposed. It's caused by asbestos. It's not related to smoking at all. There's really no effective treatment known, and it's a fairly rare type of cancer, and it's fatal. It's a very progressive type of cancer. Why are we interested in it here is that our occupational health clinic Windsor experience, we actually had 30 mesotheliomas that we've dealt with. Most of them have come from the construction industry. That tends to be mostly industrial type of construction. Steam fitters is another large group because that's steam fitters and plumbers. And what happens is they used to wrap the asbestos around the pipes of the boilers. And so they had very high levels of asbestos exposure. There's some that we've been seeing from factory work. Some of those are electricians who would have worked in close proximity to the different pipes. And we actually had 2 people from hospital backgrounds. One of them was a nurse, and what her job was years ago was she took the surgical gloves and she had to put talc powder in them. And talc contains asbestos. So she'd go out into the stairwell, pour the talc powder into the surgical gloves, and you get this whiff of talc, and that's how she developed the mesothelioma. The reason why we're very interested in mesothelioma is because it is definitely an occupationally related disease. So if we can see most of the ones that are diagnosed out there, it gives us a better understanding, and prevention is the main thing. It's kind of difficult to prevent something that was exposed 40 years ago, but we can ensure that no further workers are exposed to it. In addition, looking at lung cancer, smoking increases the risk of lung cancer anywhere from 12 to 20 times. Asbestos exposure on itself, if you're a non-smoker, increases your risk for lung cancer 5 times. But if you're a smoker who's also had the asbestos exposure, your risk is increased 50 to 90 times. So it really is a synergistic. It adds on to the risk of the cancers. Occupational asthma. Ivan will be talking about occupational asthma in agriculture. Metal working fluid lung disease is something which is quite prevalent around here. Metal working fluids are used as a coolant in any of the machining. It keeps the temperature's down, and there's a lot of metalworking fluids used in the automotive industry. It's the problem with the metalworking fluids is that they can become contaminated. You can get bacterial growth, and so they add in biocides to kill off the bacteria. Because you're machining, you get metal into it, different alloys. If you're cleaning the floors, you can get cleaning agents into it as well, contaminants from many sources, because a lot of the metalworking fluids are reused. And so what happens is, over periods of time, it can become contaminated with different types of bacteria, and that's what produces problems. You can get skin effects from metalworking fluids. Over here is a contact dermatitis. This is folliculitis, inflammation of the hair follicles, and you can get oil acne. It's also been associated with cancer, increased risk, including cancer of the voice box, the rectum, pancreas, skin, scrotum, and bladder. The latency is greater than 20 years, and the fluids that used to be used many years ago are totally different than the fluids that they're using nowadays, as well as the amounts utilized. It can also produce a number of lung diseases, and in particular asthma, and something called hypersensitivity pneumonitis. The same thing that happened with the hot tubs can also happen with association with metalworking fluids. Avian flu. I'm going to spend a good 10 minutes talking about avian flu at the end. I feel it's very pertinent to what we will be dealing with. Environmental tobacco smoke. We'll also talk a bit about that and the health effects, especially respiratory health effects of environmental tobacco smoke. And indoor air quality is going to be a seminar series later on during the year.